evening, everyone. I want to say thank you so much for coming, for Interfaith Works coming to our second in-person community conversation. And the topic tonight is advocacy around persons experiencing homelessness. Just to give you a little bit of what's going on in the county, at one point there was such a small number that everyone could fit inside Stepping Stone, but not anymore. Right now, we have almost 100 families that are in hotels right now. So we're talking about homelessness of families, but also homelessness of persons who are experiencing homelessness that are singles as well. Quite often what happens is that people will overlook the persons who are individuals, but will gravitate to the ones who are families because they got babies, right? But everybody deserves a roof. Everybody deserves dignity and respect. But in order for any of that to happen, and so that we don't mirror Washington, D.C. with the numbers, that means that there's some advocacy that has to happen within our county. And in order for us to advocate, that means everybody has to stand together. Because as we are standing in silo mentality, that doesn't work. Because nothing gets done. If we're louder, if we're bigger, and we grow and we stand together, then things happen. So we have some amazing people here today, and I want to thank the panel so much for coming. So I'm going to go from the left to the right, and I have Donna Gabrielle, and she is from Interfaith Works, and she is the Director for Vocational Services. Please pardon my voice. I am losing it. It's been going away since Monday. And we have Pastor Terry Murphy. And just a little bit and pause about her. If you ever want to see someone actually doing the work, every Sunday morning she's going out into the encampments. So you're talking about somebody with boots on ground. And I want to say thank you so much, and she's become a fast friend. Then we have Ms. Dion, and she's going to talk to us about her story. But she's going to tell somebody that you don't, just because sometimes you get lifed, but then you can also stand after that. Then we have this amazing Dr. Kelly from Kelly Collaborative, and she's a person that actually comes into and is partnered with Interfaith Works that does the medical stuff that we need on a daily basis. Doesn't have to do it, but she does, and we're so grateful. We have Pastor Burton, and it's from Converter Church. And every Sunday, he holds worship service inside Progress Place so that the people have a place to worship. He doesn't push it on anyone, but he does say he opens the door. But not only that, on Tuesdays, on every other Tuesday, that's what we have is Transformational Tuesday. And Transformational Tuesday is literally transformational. Because, sometimes people need a haircut. Somebody sometimes needs their hair done, their nails done. They need somebody to tell them that they love them because people overlook those persons happen to be getting lifed. And then we have this amazing person. I call her amazing because she does a whole lot of work. Her name is Liz Kruger, and she's the Director of Housing Services at Interfaith Works. All of the things that you all see when you're talking about our shelters, our rapid rehousing, our supportive housing, she runs all of that, but she has an amazing team with her. But she can't do it by herself. But in order for leadership, the work reflects the leadership. And I just say thank you so much for being my friend, but also my colleague. It's amazing to work alongside you. And then we have the director of Stepping Stone, Executive Director, Stacy Gold. And she actually takes care of the families. And when she came in, she said, we got to be louder. We got to do more work because there are too many people out here that doesn't have a place to go. Families don't have a place, don't have a roof. And so she's here, and I'm so grateful that she decided to come and be a part of our panel as well. And then we have Christine Hung. And I dare say that I don't think there's a person in this room that doesn't know her. But she is a person that was at Interfaith Works for many years, doing the work. But then I feel that she was elevated to another position in the county to even do greater work. And it's reflective of the work that is happening now in the county. An amazing person, but has a sweet heart for the people. So I'm going to step out the way for a moment, and I want our CEO to give you a welcome, and then I'm going to step out there. Then we're going to get started. And his name is Courtney Hall.
Thank you, Rosalind. Okay. So, yes, I'm Courtney Hall, CEO for Interfaith Works. Have the pleasure of working with all of these people here and all of you in the audience as well. I'm not sure how much more I could say, to be honest, Rosalind. You did a fantastic job of opening this up. What I would like to say is that it's really important as an organization, as a community, that we have these kinds of conversations. In your daily life, the things that you're doing regularly, it can be easy to not think about how important discussing the issue of homelessness is, but it is extremely important. This will likely be covered by the panel, but since I have the mic, I'll say just keep in mind that in Montgomery County, where many people think of our streets as being paved with gold, we had a 53% increase in the instances of homelessness comparing 2022 to 2023. We should let that sit with us, and let that sit with us as we think about what that means for the people who often are treated with inhumanity, often pass by on the side of the road. I love some of the stories and some of the work that I've heard from our panelists. I would just call out Pastor Darrell for some of the work he's doing with Transformation Tuesdays. I went to the first one, and what I think was most resounding with me is that people finally, in many cases, were able to feel human again. Think about what that means, to be in a situation where you don't even feel human. So when someone addresses you by your name, when someone sees you and remembers you from the last time they saw you, asks you how you're doing, and follows up and does whatever they can to help you get to where you need to be, takes the time to help you get connected to work or to medical care or to case management, or be able to pull down services from the government, or represents a faith community who is able to stand alongside you and do whatever they can to help you along the way. Think about how important that is, and then think about all of these providers represented here, and certainly those in the community who do whatever they can, whatever is necessary to help people become whole again. And that's the work that we're doing. That's the work we're talking about today. So I think I'm going to pass it back over to Rosalind, who is welcoming one of our panelists, Councilmember Lori Ann Sales, who I believe is also our lead on vulnerable communities. So thank you, Councilmember Sales, for joining us. And I hope that you all learn a lot. Please do think about your questions, write them down, or jot them down on your phone so that we can have a very robust and important conversation. And let me just also say thank you to MyMC Media for agreeing to live stream this event tonight. MyMC Media has been an amazing partner. We just had a wonderful meeting with your executive director the other day, and I appreciate the work that you all are doing to elevate this message in the community. So thank you, everyone.
Thank you, Courtney. So what we're going to do is we're doing something a little bit different. And that is we're going to ask the panel a question. And they're going to answer the question how it applies to them, okay? So the first question we have is, how difficult has it been in adapting to the increase of meeting the needs of the clients due to the increase? So what we're talking about is that 53% increase in homelessness over the past year, right? So, and I want to know who would like to be the first person to discuss it. There you go.
Good evening, everyone, and thank you for being here. I think this is a really exciting conversation we have ahead of us tonight, and I really hope we can come out of this with some great ideas on advocacy, and that we can, build partnerships in the advocacy as well. So I will first answer that question. Again, I'm the Director of Homeless Services for Interfaith Works, and So at Interfaith Works, I have to be honest, we are not meeting the needs of all the clients that come to us because we can't. So, and let me explain. We are doing everything we can. We have exhausted a lot of new resources in partnership with Services to End and Prevent Homelessness. We've opened 4 new programs in the pandemic, including shelters, a new housing program, and a food hub. So we are taking advantage and jumping at the chance to provide these services. We work longer hours. We engage in creative interventions. We do everything we can, and those we can engage who are in our shelters, who are getting case management, I think we do a very effective job of serving them. So we are meeting their needs. There are so many who try to get into our shelters, who try to get our services, and they can't because there's a capacity issue. I think visually this is the most obvious at our Progress Place location at Interfaith Works Drop-In Center and Shelter. In the summer months, there's 30, 40 people outside. In the winter months, there still might be 10 to 15. And we still haven't seen the coldest the weather's going to become. And I think we're all scared. So there's a 2-part to that question. We have done a lot of creative things, and we are open to more creative endeavors. We will not give up. But we're understaffed, we're under-resourced, and there's many neighbors who are not getting their needs met. That's the reality.
And on top of that, I will say, I'm Stacy from Stepping Stones, and we serve 6 families at a time in the shelter. So one of the things we always get every day are phone calls. Mm-hmm. And it's mostly from singles. We get families calling too, but mostly from singles, and they're trying to find a bed. Mm-hmm. And there's such desperation in their voice, and they might also say, there's no beds. Like, we tried there, it's full. Can you bring us in? And I'm like, I don't know what to tell. We really, we do our best. Mm-hmm. We can there. As far as the difficulty in adapting to the increase, for us, the increase, we see 6 families at a time, and we're always full. We were full before the pandemic, we're full now. The difference for us is that there's more people, for the nonprofit side, is there's more people waiting for housing. And why have so many people become homeless? Well, we know that many people have been evicted, lost their jobs, income now is the inflation and loss of income and so forth. So what we're seeing on our end is the impact of everybody becoming homeless, because it is taking us longer to move our families out of Stepping Stones and into housing for even with subsidies. So it's harder. Landlords are not unwilling to, maybe feeling like many of them got hit hard during the pandemic. They're not willing to take a chance on our families, and that criteria for renting has been increased. In some cases, we've seen landlords require 3 times your income. And so we're looking at a family of 4 with a 2-bedroom apartment, let's say $2,000. And it's not, even with a subsidy. So I kind of understand without a subsidy. With a subsidy, it's like, so I have some ideas we can talk about later, but that's some of the impact, and I don't, you want to talk about it? I don't know if that is on or not.
Okay. Good evening, everyone. My name is Lori Ann Sales. I'm so honored to be here this evening as an at-large council member. In our capacity, allocating resources, not just during the pandemic, but now post-pandemic, to alleviate the unstable housing market for our low-income residents has been very challenging. My staff has had to help residents who are in the midst of their most dire needs navigate a system that wasn't designed to benefit them. These are workers who are trying to transition into a totally new workforce job market. We no longer have the safety net of the CARES Act funding, and people are still trying to get back into the workforce. And so, trying to navigate the housing shortages that we're experiencing, there's over 30,000 residents that are on the wait list for affordable housing. That's why my first piece of legislation targeted accelerating how quickly we build affordable housing, because we know how important those needs are. And that's why we created funding to ensure that our landlords were made whole, because landlords are not in the business of housing our homeless population. They're in the business of making money. And so we had to make sure that they could pay their bills, that they didn't have to go through the, judicial system to evict tenants, which is more expensive for all parties involved, and just continues to strain the government's very limited resources. And so post-pandemic, I'm glad that I have our new director here who will talk about all of the new initiatives that she's had to take on, and having to retrain staff as well to ensure that they can lead with compassion as they're dealing with this population during some of their most difficult times. And so we're trying to, spread resources across the spectrum to take care of residents and make sure that they do not become unhoused, but that they can stay in their homes. And so whether it's exploring ways to increase these subsidies, to help with rental assistance, to help with utility assistance, we're exploring all avenues, and we're heading into budget season with the state and the federal government. The chaos that's happening at the federal level and the instability and all of the unknowns that are happening, resources are very thin. And so I'm glad we're having this conversation now to bolster the conversation to come.
Thank you so much, Councilmember Sales. This is really a very hard time, and I'm so glad we're having this conversation, because it's going to take all of us here and all of you and our community rallying to address the rising homelessness that we're seeing, not only in Montgomery County, but regionally. And what I want to say first is that Montgomery County is a strong county. We have a very well-established infrastructure in which to address homelessness. But the pandemic was huge, and it harmed a lot of families and a lot of individuals, and created enormous financial instability as well as a behavioral health crisis. So what we're seeing now is the result, in addition to rising rent costs, and I want to thank our government for enacting rent stabilization, because I believe that will help. I am hoping that we will see a decrease in the number of households that are facing eviction. In addition, as Councilmember Sales mentioned, all the resources that helped us prevent evictions during the pandemic are drying up. And so she's absolutely right. Our staff, our prevention staff at Services to End and Prevent Homelessness, are having to work differently. They are needing to spend more time with families, because they don't have as much financial assistance to prevent those evictions. So then they need to do financial counseling. They need to refer to resources, legal services, behavioral health services. And so we need to work smarter, and we do absolutely need to advocate. So I mentioned the behavioral health crisis. Our staff in our shelters and our supportive housing programs are exhausted, because they sustained our very vulnerable populations throughout the pandemic. And we need to come in with support, the support that they need. We also have a fantastic group of providers that are represented by Dr. Kelly and Healthcare for the Homeless. They go into our shelters and they provide direct primary medical care as well as psychiatric care. We need to support them to ensure they have the resources they need to provide those services to all the members, all those in our shelters, and also our supportive housing program. I think that work is often unsung by both you and Dr. Burrows. So we need to continue to advocate for the resources we need so that our most vulnerable households aren't the ones who are at most risk of homelessness, which is currently the case, and it's very hard work. So the other thing that CEF is doing is coming in with the support we can, providing trainings to equip everyone to work with the population effectively, and just continuing to look for the partnership, looking to our lived expertise. I was so happy to see Dion here, and I'm really looking forward to engaging in the conversation further this evening.
Okay, thank you.
Good evening, everyone. I'm Pastor Darrell A. Burton, the pastor of Converted Heart CME Church in Montgomery County. We are the first CME Church in Montgomery County, and it's a privilege to be part of this panel discussion and conversation on this evening. I came into this relationship with Interfaith Works Empowerment Center back in February for a walkthrough to see how our faith-based organization could be of assistance to the clients there to offer some services during the week. And that conversation turned into us actually engaging into a worship experience on Sunday mornings prior to the clients having their brunch. That has turned into us showing compassion in a way, as Councilwoman Sales just mentioned the word compassion, of us having our Transformational Tuesday events every other Tuesday, which has put us in an opportunity to connect with the clients at the center, but to really get to know them, because that's one of our pillars of our faith-based organization, Converted Heart. We have 4 pillars. The first one is being Christ-centered, connecting with individuals to help them to have a relationship. Then caring hearts, how we can be authentic in sharing our hearts with your clients. And then also cultivating relationships, was what we are doing through our Transformational Tuesday events. And then certainly being community-minded, making sure that we have our hands on the pulse of what's going on in the community. So we've been there just actively trying to engage and stay connected and learn who the clients are and be, as you mentioned, about knowing them by their first name and calling them by their first name. It does a wonder. It's a wonderful connection. I'm grateful for the opportunity. And we're just here just to be a resource, to be able to extend some support to help them prepare for interviews. If they're getting prepared for interviews, we also have opportunity to give clothes if that's needed. We give socks. We just really ask the question, what is it that you need? And when we ask the simple question, what do you need? We find out that we can give them and try to support them in whatever they stand in need of. So that's why we are there. I don't think this was by accident. I think it was God ordained. And I'm just grateful for the opportunity to be here tonight with you guys.
Thank you. Hello, I'm Dr. Catherine Kelly, as they said, owner of Kelly Collaborative Medicine, and we work in the homeless shelters with primary care. In addition, we help to start and help run the homeless medical respite in downtown Rockville. So I feel like a lot of the challenges that I've seen and the difficulties I have are reflective of medicine in general right now. So during the pandemic, we talked a lot about healthcare disparities and inequities in healthcare and how that has disproportionately affected minority populations. And we also know that in the shelters, it's disproportionately minorities that are seeking services and undocumented individuals. So those health disparities they already were facing are now amplified by homelessness, because we always say housing is healthcare. So those who are unhoused actually experience a higher morbidity and mortality rate. Their physical age is much more advanced than their actual age by about 15 years. So you can imagine somebody who will be 50 years old in the community that's housed will be 65 age and dealing with other health issues and lack of access to healthy foods, lack of access to just, even if you think about just water, those kind of things. And then we also are seeing a higher number of homeless that are elderly. So as one of the challenges we face in the medical respite is that, first of all, we just don't have the capacity to take on the level of care that's needed for those patients. They need one-on-one care a lot of times. They have dementia, they have other issues. So I think that's one of the difficulties that we need to really work on fixing, is how do we address elderly homelessness, because it's going to continue to be a problem as the population ages and as their health care worsens. They're going to need more resources. And I think Christine touched on mental health, but mental health is a huge issue, not only in our homeless populations, but in all my patients that I see in private practice as well, and the lack of resources. You know, Dr. Burrows is amazing, and I work with her both in my private practice and in the shelters, and the things that she's been able to do to add to what we do in just regular healthcare is outstanding. So I think we can together kind of address it and work on some of these problems, but we definitely need the resources. The last thing I'll mention is just from a staffing standpoint, especially in medicine, nurses get paid quite a bit of money now after the pandemic because they're in high demand. And so if we want to be competitive and attract good candidates who really care about the patients that we're taking care of, then we have to be willing to pay them accordingly and be competitive. So I think that's another difficulty that I'm finding is with staffing. And you have to have a heart for this to work in these places, because, you know, a big part of what my mission is as Kelly Collaborative Medicine is I want people to be treated with respect and for them to feel safe in my space, not just in the shelter, but in my office as well, to be tolerant of the things they have going on. If you walk into my office, nobody should know that you're one of my homeless patients or that you're one of my lawyers or doctors that I take care of, because everybody should be receiving the same level of kindness and health care in those spaces. The challenge I face is that I want to treat everybody equally, but I don't have the resources to do so if they don't have insurance or we don't have some of those things in place. So.
Thank you. Good night, everyone. My name is Dion, and I'm so happy to be here. I'm excited to be here because actually my story is a little bit different from a lot. I've actually lived in a shelter for 7 months. And I just have to give you a little backdrop of how this came about, because I'm a hardworking single mother, and I work 2 jobs for, you know, everything to go well. In 2020, during the middle of the pandemic, I started feeling back pains, and that back pain led me to lose 1 job. Eventually, led me to lose 2 jobs. I didn't lose my second job. It was just, you know, I was just put on whatever they call it. I worked there for like over 20 years, but I was still classified as part-time. So I really got part-time benefits. So quick, in no space of time, I realized my home was in jeopardy. I had a young man battling bipolar because his father had died, and he was a daddy's child, and he never came back to normal from the moment his dad died. So I'm fighting for my house, and I'm fighting for my son with his mental health. So I didn't know anything about any shelter. I've never been in a shelter before or nothing. So we ended up at a family, one of my cousins, and anyone deals with mental health knows one thing. Whenever you're labeled or stigmatized or the word mental health is attached to you, people get scared and people really don't want you there in their space. So right there and then, my son, he got sick, and he was taken to the hospital. He spent some time in the hospital. While in the hospital, I said to myself, you know, I gotta do something. I can't let my son come back into this environment. So I called the crisis center. When I called the crisis center, you know, they said, yes, we have a bed. We have a bed, Mr. Linton. And I was placed in the Cofield women's shelter. It was not exactly built as a shelter, but it was a community center turned shelter. And I was there. My son came from the hospital. The doctor, they called me and they said, you know, we're sending home your son. I'm like, home to where, doctor? We don't have a home. So they said, but we can't keep him in the hospital. We got to send him home. I said, so I got the number of a shelter, another shelter, a men's shelter up there in Goody, and I gave the doctor that number. and stuff. So they sent my son home to that shelter. However, while he was there, he came home at that shelter. No one even asked him nothing. He didn't get the care, I would think he would get. I know it's a shelter, but just like the basic things. Not the basic, like, your bed, here's your meal and whatever, like the basic, conversation with him, what are your plans, what are you doing? Nothing, because I talk to him all the time, and even at my shelter, he didn't really stay there much. Everybody at my shelter, they know him, because whenever I go for meal, they give me 2 meals, because eventually he started sleeping in my car at my shelter, because even though I was in the shelter, I still go to work every day. So there we had a little problem with the county, said he can't sleep in the car on the property. So I parked the car on the side of the road, and he slept in it on the side of the road. And for months, that situation went on for months, and most of the time the ladies them in the shelter that I was with, they actually kind of adopted him. Even the women that give lunch, they would be like, how much dinner you need today, Miss Dion? Is the boy in the car? Because at his shelter, he figured, I even went up there and I said, do you all talk to him? They said, he's so quiet. I said, but he's shy, And one of the things that stand out to me is like, suppose how many people, how many young men or women are like him that has mental health, dealing with mental health, doesn't speak a lot, are in the shelters, and they're just there, No one is there, advocating for them, speaking to them, and whenever I got through, I got housing via the shelter that I was in, because my shelter, I'm a very outspoken person, so, I speak to them a lot, finding out what's going on, stuff like that, until we got to move. And I vowed to myself, I said, even though I'm out of the shelter, it's been like almost 3 years now, I'm out now, I still tell myself, if there's whatever way, in any capacity I can do to help, I'm going to help, because I see, some needs in there, some huge gaps and needs that are in there. And my spirit hurts me when I think of people that's in there with mental health, Just thinking about that, will let the tears come. So, we got to try and do something better. Thank you.
Thank you for sharing that. That's very moving. My name is Reverend Terry Murphy. I'm from Episcopal Church of the Ascension in Silver Spring on Sligo. We're just off downtown. Something in her story resonates, because I don't think there's a single person who can ever be really positive that they will never face homelessness, no matter how hard they work. And that was obvious during COVID, certainly. It was obvious. The numbers just jumped up. I started doing some homeless work from the church. It's been about 4 years now. And I thought at first, what can I do? I'm not a social worker. I don't have a lot of connections with some of the things, legal connections or any of that people need. And I was brought back to the thought of what we say in our baptismal vows, that we will guard the dignity of every human being. And if I see someone sleeping on the street and I drive by, I'm not guarding their dignity. So I decided I'd rather do one thing well than try to do more than I could handle poorly. And so exactly what the CEO said, that's what we're after. Our goal is to notice these people and to give them some dignity. Now, what we do is humble, it's small, it's much smaller than what all of you are doing. But we go out, it started out with just early Sunday morning at 6:15. I would be out on the street with a companion. We always go out at least by twos. And we would give them a little packet of bottle of water, a granola bar, and a $10 grocery store gift card. We've expanded that to adding Panera gift cards and Starbucks because we want them to have the dignity to get a cup of coffee like anybody else without having to beg or look for dirt, coins in the dirt. What we do is when we give these things out in the wintertime, we also give out packets of gloves and hats and scarves and whatever else. We've gotten a lot of donations. But we've seen the cost of this over the pandemic go up from about $1,000 a month. It's now up to $2,500. And we thought, this is a small church. Who is going to support this? I'm so proud of them. They've stepped up to it. They do fundraisers for it. People just stop me in church and give me a handful of grocery cards. And it's something simple that we can do. It's deceptively simple, but the important part is not even the items we give them as much as, what's your name? How are you? We don't cross the street to avoid them. We look for them. And they oftentimes are shocked when we approach. And so I've trained now 12 people. I do train as to what to do and what not to do because there are things you have to be aware of. I've got 3 teams of a total of 12 people, and I'm looking at starting a 4th team to expand what we're doing a little bit. It's not much. It's little, but it's the little things and being noticed that really give a person value. And we ask them, since we're a church, we ask them, is there a way we can be praying for you in church? We don't care what religion you are, but what do you need? What can you tell us? Just first names. And they are amazed when we come back the next week and I'll say to someone, well, so-and-so, how are you feeling about that now? Have things improved? They're shocked that anybody notices and remembers their name. One gentleman, I saw him for about 3 weeks in a row, and then he got housing and a job, and I hadn't seen him for months. And I happened to run into him at work, at his place of employment. And he recognized me. It's hard to miss this. He recognized me, and I heard him say to a coworker, "That's the lady." And I thought, who said that? I turned around, and I said, "Harry," that's not his real name, "Harry, how are you?" And he just put up his hands and said, "She remembered my name." That's how important that is. And so all we can do is respect their dignity, and that's what we're trying to do. And God bless you all for what you're doing.
Thank you. Good evening, everyone. My name is Donna Gabriel. I'm the director of our vocational services program with Interfaith Works. I don't think you can talk about solution for homelessness without addressing the workforce development that needs to happen. Our program focuses in helping individuals who are at risk of becoming homeless and those individuals who are experiencing homelessness find employment opportunities. But it's not as simple as that. And to address the question that is posted, our program is very small. We are 5 vocational counselors. 3 of them are bilingual, Spanish bilingual. Because of the needs of having to help this population, we advocated for a case manager in our program. There's a lot of barriers that come in helping individuals find jobs, and it ranges from depending on the population that we're helping. So the undocumented population, they might need resources for obtaining their proper documentation, tax ID forms. Having an I-10 will help them find jobs, perhaps not jobs that pay the minimum wage, but at least it will be something. Those individuals who are single parents, they come with different types of barriers that we are often having to find resources for, because our program is also limited in resources. I think it's important to not just talk about solutions, but also identifying the problems with helping, again, our clients find jobs. I'm very happy to say that, at least with our program, what we're doing is finding creative ways to come up with solutions that are happening right now. that involves training opportunities for individuals, partnering with other organizations, with other nonprofits, going out and learning about what employers are looking for. How can we improve our clients' resumes? It's a conversation that it's important to have. I myself am very thankful to be here in this panel because like I said, being in the vocational program and having that responsibility in helping individuals find jobs is a big responsibility that I'm carrying in my shoulders right now. So I'm learning a lot from all of us here in this panel. Thank you.
Thank you so much for demonstrating, one, that there had to be a change in the way how we addressed and how we respond to the increase that has taken place. And if you notice that each person and each department and each component of it has its own part, right? And so it stands to say that as we stand together, that's the only way that we can make it work. So because of that, I'm going to skip over some of the questions that I sent you all and go straight to gaps. And the reason for that, because we had to identify the gaps in the system in order for us to make those changes. And so I want to ask you, one, what changes, what gaps have you identified, and how have you changed in the way you have managed and organized and tweaked in how you respond to what's going on right now? Not just the increase, but also how have you done, what have you had to adapt in your own departments and in your own space and in your own home and in your own, and just how you're doing everything when you're addressing the homelessness population. I'm going to start with you, or you want me to move?
No, I'll
You're
start.
good?
So one big way that we are learning is data collecting. So data tells us a lot. That also helps us understand what is working, how our outcomes are, where they are at, but also to advocate properly and strategically when we're trying to, again, raise funds. We are a nonprofit, so we're often having to look for ways to find funding for our programs. The biggest gap that I think we have found is that, yes, we're helping individuals find jobs, minimum wage, but the bigger problem is the cost of living in Montgomery County. $17 an hour, how is that going to really address the bigger problem? If an individual gets sick and the problem trickles, so they're behind on their rent, they're behind on their car insurance or their bills. The problem is no longer finding a job. It's addressing all of those situations and helping the client become stable first and then look for a job. So for us, at least, is understanding how can we collect this information, present it in a way that when we're talking about these problems, those people who are not aware of our services and the work that we're doing can understand it from a position where numbers are telling a story. What we're often doing is really also focusing on the quality of service. It's so important, and I've been educated by our other programs and other individuals in homeless services about how to be mindful when we are serving this population. Kindness goes a long way. Learning individuals' names, looking them in the eye contact. But like I said, I'm going back to the same point that I made earlier. The biggest gap that I see is the cost of living in Montgomery County. It's a bigger problem. And yes, we can help individuals find jobs, but who's going to address that problem? And for me, that's the biggest gap that our program is seeing.
Thank you. Well, I think in terms of what we're doing, fundraising, it comes down to that, basically. How are we going to how am I going to keep telling my congregation, it's growing, we need more? And yet, every time that we've needed it, they've stepped up. But we've started doing some fundraising. We have a Christmas concert coming up. The proceeds will come to that ministry. We also have a need to find out where more and more people are. As you know, homeless people are oftentimes afraid to be noticed, and they can hide in plain sight. And so we have a police officer that has done security for us, and I know him quite well. So I will occasionally call him and say, where are you seeing the increase? Tell me where I should go and where I should not go. I've also increased my contact with Bethesda Cares. They work with homelessness in Bethesda, and yes, there is some there, and Silver Spring. If I see something unusual on the street, more and more that's happening, I will contact them and say, I know you can't tell me anything, they have a right to privacy, but I'm seeing something happen odd here, and I just want you to know. And they will always say, thank you. They actually trained me a bit on this. They'll tell me, thank you for letting us know. They can't tell me. I don't want the particulars. I just want them to know. I find I'm doing that more and more because I'm finding more things going on and training more and more people who are interested in being out on the street. That's pretty much what I'm facing right now.
Okay, good night again. So since I can't speak about the spectrum of organizing, money, and all of that, and what I can speak about is when I was there, what I saw, what was needed. What I saw that was needed in the shelters, we need more people trained in the area of communicating better with the residents. People trained in recognizing when someone has a mental issue, because most of the time everyone is treated the same way, they talk to everyone the same way. So for instance, like with my son, he was, even after he came out and was on medication, I called him and I said, can you please let him take his medication and stuff like that. And, it was just like talk that went into thin air, because, this was just I don't care about that. I just want to make sure he is he has his bed, he has a meal, I think there's more training need, more people with training need in certain areas that I see that was loud and clear. So that's the area that I can speak about. So that's the area that I'm speaking about. Thank you.
So I have a couple gaps, and I think that we've done a good job of addressing some of those gaps. I would say the first one is actually the formation of medical respite. So we saw a need of patients that were being discharged from the hospitals back to the shelters, and they needed a higher level of care. And shout out to LaSonia Kelly in kind of spearheading that and being my go-to, and Sabita, you may have met Sabita, with her really being at the forefront of that project to address that gap, because that was a huge gap. We still haven't met that need totally, and as more people are becoming homeless and then go to the hospital for a lot of their primary care, they're going to come out and need a higher level of care. So I think that's one thing we got to continue to work towards. I think the second gap that we have been trying to work towards is being proactive about medical touches. So how can we touch more patients when it comes to their medical care? So we did a survey of our partners and tried to come up with some strategies. So we're going to do some things to help educate the case managers and the staff on what actually our job is and our role is as Kelly Collaborative Medicine and as a partner with them, and what things can we do to make sure that when a patient comes into the shelter, how can we address their medical needs more directly and get them in contact. It may not be directly with us, but part of what we do is also getting them in touch if they have a primary care, making sure that the case managers understand about how to apply for Medicaid if a patient is eligible, and also after that person is housed, getting them in contact with the safety net clinics and the Montgomery care system. I think that Interfaith Works, I'm sure they're going to talk about this, but Lon's House was definitely one of the gaps that's been filled when it comes to supportive housing for people with medical needs, and we're very blessed to partner with them in that endeavor as well, and provide nursing and physician, nurse practitioner care in that arena too. And then I think mental health is always going to be a gap. The county has expanded they have a psychiatric nurse that's actually going out and working with Dr. Burrows, and so that we can also get more of those medical touches, get to more people, and hopefully prevent the things that happened with your son from happening again. And I think across the board, of course, this is a much more vulnerable population, and how do we meet them where they are? I think Bethesda Cares and Every Mind, and they have also been very good partners with us with bringing in patients. I mean, I feel like at Progress Place right now, most of the patients I see are ones who come in from Every Mind who are street homeless, and we're trying to address their medical needs and get them to a better place, providing them with medications. And those case managers are doing a great job of following up and making sure that they're filling those gaps.
I guess that's the new kid on the block in this endeavor. I don't really know what the gaps are, so I'm going to speak from the standpoint of what we do, and I'm going to talk about Transformational Tuesday. I didn't think this was going to be a problem, but it turned out to be a little bit of a challenge for us, where we connect with local barber shops and local barbers in the area to connect with us to do the work. Well, that became a challenge, because ideally what I wanted to do was start with at least 5 to 7 barbers to come in and begin to cut the hair of the clients. Well, I could only get 2 or 3, and I became one of those persons who had to put on my uniform from back in my college days, because I didn't go to the barbershop when I went to college. Being part of a fraternity, we cut each other's hair, and we took care of each other. And I have 2 sons who are over 20 years old now. One is about 33, but they did not go into a barbershop. And so all of that experience came back to the forefront of the work that we're doing now. And so we've been able to bridge the gap. And I discovered just this past Tuesday, that one of the clients there actually cut hair. And so we're going to incorporate him and bring him into the fold, and we're going to see how we can continue to expand on what we need to be able to meet that need the Tuesdays that we are there cutting hair. So when you're doing this type of work, in my opinion, you just have to learn to be flexible, and you use what you have, and what you don't have, you try to find out where you can get it and how you can go forward as you move forward in this program, in this process.
So before I go back into how I would apply this question to Interfaith Works, I want to give some more propers to you, Pastor Darrell, and you too as well, Terry. That I think the need you are meeting is a major gap, and it's social capital. Like, we talk all the time about needing more money, more finances, like how are we going to fund this, right? I mean, any finance person will tell you, ask me the question, the answer is money, right? But this is about so much more than that. Because people, in my opinion, are the most important resources, and our population is so disenfranchised, so alone, so without self-worth, relationships. And when we made that plea to you back in February, this is the part, my team knows it, this is the part where I get emotional. It was because of that, because we have such a problem. We get people to donate and do a lot of wonderful things for us, but we need the relationships. We need people to come in and know our population. And you have no idea what that does for them, to know their name, to know their story, to talk to them. I mean, in Dion's story, what always gets me worked up is wondering what would happen to him if she wasn't there. Would he still be in a shelter? Would he be in another jurisdiction somewhere lost, right? I mean, those are the kind of things that keep me up at night. And so it's like, historically, barbershops bring that, right? And you're bringing that to Progress Place, and you too, Terry. And I think we really appreciate those kind of relationships, because it's hard to quantify, but making our people feel human is absolutely beautiful. So thank you. That was like I really went off. That was just a side note, not even answering the question. But social capital is a gap, and we need more of it. And I think that you can see everywhere, like in the county, in the country, where social capital has declined. It's been declining for decades, but then the pandemic increased it dramatically, where people are having less dinner parties, people are having less picnics, and that may seem irrelevant to what we're talking about, but it's not. As community declines, we see the direct impact on populations that are already disenfranchised, right, that are living in poverty, and we see an increase in homelessness, and it is largely people of color. So it needs to matter to us a lot, the social capital piece. So other gaps, so Interfaith Works, we have our 4 shelters, our 7 housing programs, and all of them are under-resourced in some ways, right? They are not fully funded. They don't have the skilled staff they need to meet the needs of the population we're now seeing coming into homelessness. So I think we said 53% increase in homelessness. What we haven't said, we've alluded to, Dr. Kelly said it, Christine said it, I think Lorianne, you said it too, the mental health, like the increase in mental health conditions in that population what was dramatic as well. It was like almost 40% on the individual side, even higher on the family side. I think the substance abuse was glaring. Like that was dramatic. And we feel it. We feel it every day. Like we know it, right? But the actual statistics were so alarming to me. I think on the family side, there was an 88% increase in substance abuse. So it's all related to mental health, right? It's often the coping mechanism. So we are serving that in homelessness, and we are feeling it in every single program acutely. And the kind of training and support we need, we're trying. We have one of Christine's legacy items. She left us with a trauma therapist, a coach that works with our staff, and we do what we can. But ultimately, we're not a mental health organization, and that's the kind of service we're being asked to deliver. So we need to pay the staff and to train the staff to serve this population, because we are seeing something we've never dealt with before. So that's the major gap. I could go on about prevention. There's a lot of things I have, but I'm going to hand this over to my colleagues.
Okay, thank you. So in the family arena, which is where I represent, I would say the biggest gap is childcare. While the state of Maryland does have a program where you can apply for subsidized childcare, it's clunky, it takes time, and you sort of have to have a job for 2 weeks before you get childcare, and I'm always like, well, what are they going to do for those 2 weeks? So I think that's difficult. Also, that the subsidy, we have families who want to, their mom would take care of their child, but would need some financial support to do it. Or someone in the family, a lot of times there's resistance to doing that. Maybe someone in the family that they're living in had a criminal record, and then that would never fly, and things like that. So there's some barriers to the child care. The other barrier when we talk about child care is a lot of our families get jobs that are retail, restaurant jobs, jobs that happen off hours. So we're not doing a 9-to-5 job. We're going into Target from 4 to 10. What do you do with your child? It's so hard. Again, I think you want to lead on your family to help with a vulnerable population, and many of our families have burnout relationships with family members, so a lot of them are vulnerable. They don't have that as well. So I'm not sure exactly what the answer is to that, except, and this might have been done already, to fast track the Maryland child care for families who are experiencing homelessness. Like, they're in their own category. Fast track them. the first thing we want them to do is get a job, and so they could, start earning some income. The other gap that I see is, I'm not sure if it's a gap or it's a problem, part of what we've been talking about here and the rise in so many families now. And when I was saying we see 6 families at a time and we're always full before the pandemic and not, the impact of what's happening now is I feel like Stepping Stones is like clogging the system because we cannot get our families housed. They have subsidies. We've got, the county is very generous with the subsidy programs. We have permanent subsidy. We're having the rapid rehousing subsidies, the SHARP benefits, and the COVID relief at that time. The money is there. We can't get our landlords to accept our families. And Courtney and I were talking about it earlier, whether or not it's a bias, where they say things like, we had a family who had an HOC voucher and just got denied yesterday. I said, what happened? She said, credit score. I'm like, you have an HOC voucher. Like, it's going to be paid for. And, they've had a job. They're two-person family. They've had a job. It's infuriating. And so so that's where I feel like we're a little bit of a clog. Like if we could move our families, of one family in there since February, if we could move our families along more quickly, we could help resolve this backlog and really catch up a little bit from the COVID. So thank you. That's my soapbox.
It's not just you. We have that problem too.
Oh, I know. That's what Courtney was saying too. I mean, well, I have some ideas to solve that, but we'll talk about
Yes, no, I think we need to talk about that now. Stacy, you raise a very important issue. Homelessness is an issue because of our history of racial injustice and because we don't have enough affordable housing in our country. And so we need to approach that very assertively. We need to talk about the fact that even though we have housing and we have support from our government, it is very difficult for households to move out and to be accepted into apartments with the subsidy.
With the subsidy.
And our government enacted the Housing Justice Act and came through with that, but we need tough sanctions so that when a landlord denies a household housing, that there's a consequence that comes around to that. We can't just provide the subsidy, we also have to address the injustice. And it's 60% of our households that are experiencing homelessness that are people of color. And we cannot just stand by and let that continue to happen. Our partners at the Department of Housing and Community Affairs are working diligently both on rent stabilization and on creating more affordable housing in our county, but that's not enough. We need more action as far as addressing the racial injustice that we continue to see. In addition to that, I'm just going to add a few more items to our list of gaps. Dr. Kelly did a good job of talking about our need for specialized health care and behavioral health care. We also have an aging population. We are seeing our baby boomers age, and an increasing number of older adults experience homelessness. It was just yesterday, and Jerry, one of our wonderful directors at Interfaith Works, was dealing with an individual who had issues with her activities of daily living, and she struggled to enter shelter because she needed a health aide to help her with that. We don't have that for our homeless system. We need that, and we're going to need it more and more because we are seeing more older adults sadly experience homelessness. So our shelters, our programs have to be equipped to support those individuals so that they can regain stability, regain housing. So that's an absolute need and an absolute gap that we see. And then, okay, so I'm sorry, I'm going to add one more thing. Go ahead. All right, so we have to not only talk about sanctions with our landlords, but we have to continue to recruit landlords so that they will work with our families, all of our households who are in shelter. And so one of the things we have to strengthen, because it's many of the people at this table know Cassandra Bolton. She's wonderful. She manages at CEF 18 contracts, and then on the side, she's trying to recruit landlords. We need a focus solely on landlord recruitment, someone to do that, because really, if we don't have enough landlords willing to house our population, then we're not going to be able to house them. And then last of all is, of course, more housing. We have about 3,000 units of housing specifically dedicated to the homeless population. That needs to increase annually in order to keep up with the need. Those 3,000 units are being used now. Our diligent team of workers, including at Interfaith Works, have continuously ensured that people are moving into housing, but we need to increase that. And that's supportive housing with the staff present to ensure that people are succeeding in their housing. So I have a long list, but I will stop there and I will pass it to Councilmember Sales. Thank you.
Oh, thank you, Ms. Hong. So, we talked about resources, and we've infused a lot of resources into the housing needs of our residents. I'll just speak to one issue. One allocation of $77 million in funds from the Department of Housing and Community Affairs in the FY24 budget to preserve and increase the supply of our affordable housing supply. And that's something that we have to maintain our current housing supply. And now that we are seeing a totally new workforce, we're seeing a lot of people working from home. We now have a lot of office vacancies that we're experiencing. And so the Biden administration recently approved funding to help developers with transitioning office buildings into affordable housing. With inflation, we're seeing almost a slowdown in how much housing is coming to market, new housing. And just because of the financial constraints of how many people are even investing in increasing affordable housing. You heard about the seniors that are experiencing homelessness at a higher level. We also had more women experience homelessness during the pandemic. We found that out during the pandemic because of the unemployment numbers, who was applying for unemployment, and now trying to get those women back into the workforce. We're also seeing an uptick in the LGBTQI plus community. I believe it's in either the District of Columbia or Prince George's County that DC just opened its first homeless shelter for LGBTQ plus adults. And so trying to replicate something like that in Montgomery County, we just met with a nonprofit provider who wants to open a shelter dedicated to that population, especially our youth. This is the population that we are seeing the highest rates of suicides. Gay and lesbian residents are 2 times likely to be the victims of violence. Transgender individuals are 2.5 times more likely to be victims of violence. Bisexual individuals are 8 times more likely to be subject to domestic violence, more than twice as much as their lesbian and gay peers. And then LGBTQ plus youth are more than 4 times likely to attempt suicide than their peers. And so we have it's like the second wave of the pandemic. We knew that these issues were underlying, but the pandemic totally exacerbated it. We had an infusion of money to put a Band-Aid on the problem, and it was ripped off when that money dried up. And now we are trying to cope with a whole new myriad of problems with much less resources, and the population of needs, and the needs are varied and they are increasing. And so I'm so glad we have these partners here to help people not only get access to, resources, but also a road to self-sufficiency, to have access to workforce training and development. We just had a discussion today with our frontline workers, Montgomery College, universities at Shady Grove, just talking about the workforce development options and the pipelines for employment post-pandemic, and then the needs for those workers, from our public safety officials to our healthcare workers who need on-the-job access to mental health providers, and how we are going to ensure that those mental health providers are actually going into those fields of study and not leaving with mountains of debt. And so how can we safeguard the people that we have and the resources that we have, take care of our residents while we're taking care of the people who are providing those services. And so we're really at a crossroads, and we're all working very hard collectively to holistically approach this homelessness situation, because if we know anything, Maslow's hierarchy of needs knows that food, water, and shelter are the most basic needs that we must provide for our residents. And you know the values of the community you live in when you look at where they're putting their money, their resources in the budget. And so as we're going into the budget season, these are going to be top of mind, all these issues.
Thank you so much. So now that we've talked about what the problems are and we've established some gaps, we can't leave the room without having some solutions. And with that in mind, I want to also invite you into the conversation. So it talks about a community conversation, means that we don't ever, while all of these experts and all of those of us have been working with this for a very long time, sometimes the answers can be very just enough right up under the radar that we didn't see. Because sometimes, because the persons in the room live it and are seeing things that we didn't see or haven't thought about. So I'm opening up the conversation. So I'm asking that if you have some solutions to the answer, to what we're talking about, to the gaps, or if you have questions that you have and that we didn't have the answer to, and it didn't get addressed. So that's where we are right now. So, okay. So I think they're trying to tell us something, but we're still going to keep going. So anyway, so are there some questions, or do you have some solutions that we need to address tonight? First of all, let me ask you, is there a question that's burning on your heart that you didn't get an answer to tonight? Yes.
Good evening. My name is Frank White, Board Chair for Interfaith Works, and this question goes to Councilwoman Sales, and I want it to be succinct, so let me read it here. If I were a private investor, I would invest in vocational services program because of the upside and return on investment, which is creating stability. I know the primary source of funding for VSP is through private donors and grants. As we enter the new budget season, and you talked about it twice, wouldn't it make sense for the county to focus on or even shift resources on what works with nonprofits, such as vocational paid training programs, to help boost that stability?
Well, this is a very timely topic. This is actually Apprenticeship Week. And so we have been working with our Office of Workforce Development, all of our educational partners from MCPS all the way up to Montgomery College, universities at Shady Grove, and some of our nonprofit partners to really open the wealth of opportunities that exist in these careers that have an aging workforce and have needs. And most of these apprenticeships, you can get paid while you are studying. And, Prince George's County has led the way on connecting their students. I think Montgomery County had some reservations of us exposing our children to those opportunities because we all thought all of our kids were going to go to college. But with the the lack of affordability of obtaining an education these days, and then coming out of school, you're incurring debt and, unstable job market. We are promoting these opportunities and working with our plumbers, our electricians, even the allied health careers. And so we're definitely promoting, and anyone who is ushering in more opportunities for our young people, we are willing to support those efforts financially as well. And I don't know if Reverend Warner is going to mention, but, when we talk about solutions, he's part of our solutions because, his church is doing a groundbreaking opportunity to use some of the land to build affordable housing for the population we were just talking about, our seniors. And so we need more developers and more nonprofits to think about how are we fully utilizing the space, the land that we have in a new way to take care of our most vulnerable populations. And so, Reverend Warner, we just thank you for your innovation and your visionary thought to open the doors of your congregation, not just expanding the congregation, but now making sure that our unhoused have options. So.
Thank you for passing me the mic. I'll just take it. So one of the solutions that we don't talk about enough is utilizing those with lived expertise and our peers who can directly support those who are in need of our services. And I see Terrence Hill there. He's the chair of our People's Committee in the audience. He just started his own nonprofit. And started his own nonprofit of peers. He is also an outreach worker. It's amazing to me that he's able to do that and have his own catering company. He's an amazing cook. Yeah, but peers are absolutely a solution that we need to invest more in, because what Dion spoke to so eloquently is the need for someone who understands the population intimately. And that can never be accomplished better than by someone who has experienced it and lived it themselves. So I wanted to offer that up as a solution, because we need more peers, we need more people on the ground engaging, and that's something we must invest in more. And I just wanted to stop to acknowledge both Ms. Dion for her contribution in our work and Terrence Hill. They drive so much of what we do, and I want to continue to see that.
So those were a couple of solutions. So are there any other solutions that you think that we have missed tonight? Yes.
Hey, good evening, everyone. I'm James LeBlanc. I'm the Director of Community Impact at WorkSource Montgomery. And one thing, and thank you all for your work that you're doing. I have lived experience in this space of being homeless, and one thing that really helped me, this is back in 2009, so I know things have changed. There's been a whole pandemic and everything else, but one thing that really helped me was a work bed shelter. I don't know if, I'm new to Montgomery County, so I don't know if such a thing exists here. If so, please excuse my ignorance, but in the work bed shelter I was in DC, you had to, first of all, prove you were working. This is once you get a job, and even if it's the minimum wage job, at least you have a piece of a job. You can go in there, and you have to test, drug test, pass that, show some pay stubs, and then once you're in there, you get case management. You have to. It's you have to save your money. It's put into escrow, like 75% of your paycheck is put into escrow for you, so that when you are ready to move out, you do have that first and last month's rent. You do have a financial foundation to kind of jumpstart you out into the, back into society. So that might be a solution. I don't know.
Anyone want to respond to that?
Okay, I just like to make people laugh. So when I went into the shelter, I work every day. You understand me? I get up like sometime 5 in the morning, and they would say, Miss Dion, why do you work so hard? You don't have any young children. Why you go to work so hard? I said, I just want to go to work. I just want to keep working. Because working let me feel like, I'm doing something. But all this while, I'm supposed to be saving, right? So when I did finally get my caseworker, which this is a part of the story I didn't tell you. Most of them here know, so I don't like to talk about it because I don't like to brag. It's a scene, but when I went into the shelter, I didn't become a resident. Suddenly, I became like a caseworker myself, right? So I started seeing where the ladies them were getting down. I kept a community. I asked Miss Christine if I could, we could use upstairs. I kept like a little community meeting with the ladies them talking about faith and all of those stuff, trying to, bring up back there, And then I started walking around collecting clothes for the ladies. Right? So, and then I start giving money to, and if somebody wants a cigarette or something, at that time I was a smoker too. So sometimes they don't know. I have like 4 or 5 packs of cigarettes here. So when my caseworker, Miss Tanya, she was like, so, yes and yes and yes. So, Miss Dion, how much do you have saved? I'm like, Nadla, save? She said, yes, do you work every day? You don't have nothing saved? I said, well, I did this, and they said they want to go visit their kids, and I give that, and we would just start laughing. So when he said about saving and money and escrow, I just started laughing because I didn't have nothing saved, and I worked every day. But I was in a population where, the need was so great for everything. They needed money, they needed this, they needed cigarette, and stuff like that. So, and I work at a supermarket, so sometimes I would work, peep, peep, peep. Miss Diane, could you bring us some this, some that? So I'm coming home, I'm like, here. So I didn't have nothing saved, but, again, I have to thank Rapid where I was in, they did help me a lot. So when you was talking about save, I said, I got to tell that joke. That I think save. Who else?
Anyone else? Other solutions that we haven't discussed?
So I think it's always important to just mention prevention, because we tend to be very reactive as a country, as a community, and that is clear in everything we're talking about tonight. We are so often just managing, and I will say at Interfaith Works we manage very, very well, but we'll be managing forever if we don't start really pouring resources and brain power into prevention. And there's, I like reading about things that have worked in, across the country and really in the world. And there's a lot of great ideas out there, by identifying early on what families are at risk before they get to crisis, right? Seeing how much rent people are paying based on their income, and identifying that they could be homeless, seeing what kind of disabilities are in a household, et cetera. There's a lot of ways to determine ahead of time how we can support people and prevent those who may enter homelessness or just fall into crisis. They shouldn't have to get there before we start supporting them. So I think I would love in my lifetime to see that once we have stopped putting out fires, right, that we can really pour it all into that. Sorry, I keep looking at you, L'Oreal. I'm like, yeah, you're the lawmaker here. So I'm trying not to look directly at you, but you do have some influence there. So
I'll see. I'll just go back to my piece about the landlords, and we're all singles, families. We know we're all dealing with this problem. One solution is really come together at a grassroots level. Let's figure out what's going on in the landlords' minds and Engage landlords. It's one by one. It feels like it could be, but it could be very meaningful, and possibly like understand where they're coming from, and also with our landlords consider some kind of incentive for them to house homeless families. I don't know exactly what that could be. I know we have the subsidy, and we also have a landlord mitigation fund, but does that get used frequently or? Okay. So making sure landlords understand about the mitigation fund, but I think, I think we can do it. I think when the stakeholders can come together and divide and sort of like and bring our landlords to the table, whether they're the big ones, the big apartment buildings, or the small ones. Figure out like how we can get them to, they're in it to make money, and they should be. That's their investment and so forth, and that's what they're going to do. But how can we make it work for both? And how can we ask them to just sort of open up a little bit and take more of a chance? And I think it's hard now. I think a lot of landlords were burned during COVID, and they went a year without rent, and things like that, and they were stuck paying the mortgage and or their apartment buildings and so forth. But I'd love to see a collaborated effort from the stakeholders to bring landlords together, and maybe some kind of financial incentive.
This is a holistic approach, and as we're having this conversation and talking about our landlords coming to the table and making concessions, we have to be accountable. I came to Montgomery County because of the affordable housing program. I lived in affordable housing, the moderately priced dwelling unit. I was paying 30% of my income to stay in my apartment. I was a single mom, so I was working full time. I was going to school full time. I knew that I had to do certain things to ensure that my child could have a life just like her peers in MCPS. And so there has to be some financial literacy and some accountability. Like, Montgomery County isn't in the business of subsidizing lifestyles. We're in the business of helping people reach self-sufficiency, and we will give you all the tools that you need, whether it's a Pell Grant, whether it is counseling, whether it is temporary housing. But you have to take some accountability and make sure that there's a plan. And so I've spoken with Director Hong about, is there a roadmap to self-sufficiency that when you enter our shelter, I haven't heard of the workforce, work housing, but that's what we need. When you come into the shelter and you are taking taxpayer dollars, you need to ensure that there is a game plan. What is your 1 year, 6 month, 3 month plan, and how are you meeting those goals? What do we need to do to ensure that you're meeting those goals? Because I'm willing to provide all the programs and all the support and all the training so that you can lead a life of self-sufficiency, so you can make close to what you need to make to take advantage of becoming a homeowner or living independently, taking care of your family, filling out the paperwork to take advantage of the health care, take you to the clinics that exist in all corners of our community. And so I want us to also understand that this is a shared responsibility. We are here to help you on the road to self-sufficiency, but this is not a sustaining business. This is not the business of government. And so we have to understand that at all points that we are showing compassion, we're giving you grace in your time of need, but you have to have accountability in your life, and we have to ensure that there is an end goal and a plan in place when you enter a shelter, and that the destination is self-sufficiency and living independently, and then helping the next generation. And so I'm so glad that we have people here who can testify about being at their lowest, but using government resources to have a hand up and not a hand out. And that's what we need to ensure is promoted, communicated, and understood throughout the community. And anything that we can do to facilitate that and support that effort, I'm here for it.
Okay, I have a question that I haven't necessarily heard directly addressed, but some of you may know that Montgomery County aims to end homelessness by the end of 2025. And the way we frame that is that homelessness will be rare, brief, and non-recurring. So it doesn't mean that homelessness will never occur again, but it does mean that we will design and maintain a robust emergency response system so that if you are sort of at the edge, right, of experiencing homelessness, you haven't quite lost your home, right? There are prevention resources, Liz, that are immediately available to help you to maintain your home. Perhaps those prevention resources don't work, and you do actually have to seek a shelter bed. Rather than a months-long stay, we're talking 2, 3, 4, 5 days before you're immediately able to get access to affordable housing that you can then maintain, because we don't want your experience, your episode of homelessness to be recurring. And so I wonder from the panelists, I mean, it's a pretty big goal, right? From where we are now to where we will need to be in order for that to be our reality. And I wonder if anyone wants to sort of take on how we might be able to, like, what are the sorts of solutions we need to be implementing? What are some things that we should be thinking about before we leave this room, so in the next, say, 10 minutes or so, that we can think about and carry forward? Because what we haven't yet sort of explain to you all is that this is not just a forum where we're going to come and discuss issues. Like, we actually have a plan, right? And our plan is that some of the solutions that we've been hearing today, we will be able to follow up and see how we can work with our elected officials, with our government officials, our faith communities, our other partners and donors, and say, how can we actually move the needle on some of these things? But that, for now, that's the goal, right? By the end of 2025, homelessness in Montgomery County will be rare, brief, and non-recurring. So I wonder if any of you have any reactions, responses to that. How do we get there, Dr. Kelly?
So I don't want to be combative. I think, part of solving this is bigger than just what we're going to talk about today, because we talked about some of the injustices and the healthcare disparities and those disparities, and that's bigger than I think what we can solve right this minute. And, somebody had to tell me, because one of the things that's been big is Wegovy and Ozempic, and I have a point. And I think as people who are not struggling with weight, we tend to be like, oh, well, you can just eat better, you can just exercise, you can have accountability, right? But from a mental health standpoint, if we asking somebody with bipolar who doesn't have resources to address their bipolar, that didn't have accountability, I think that we're doing them a disservice. And then to recognize that most of the people that are in homelessness are people of color, and we already know there's social injustices and healthcare disparities in those areas, to then say accountability, I think we're also not going to get to solve that problem. So I don't, I'm not a pastor and I'm not a government official, but in the Black communities, we tend to always lean on the church, and I think that's what Interfaith Works has stepped up to be, is to, those are the communities that are going to have to support the ending of homelessness a lot, and be advocates like we're here to talk about tonight, and advocate on behalf of the people who can't speak for themselves. So my bipolar patients, my patients with depression, and her story hits home with me because my son's not in the room now, but he suffers with anxiety and depression, and has autism, and I have a daughter who is 29 years old now, or about to be, and she attempted suicide when she was in high school. And so mental health is a real issue, and then to then hold them to a standard that's unattainable is very hard. And it's very emotional for me because my life could be a lot different. I could have been in your situation, could have been anybody's situation. I was a teen parent. I had my oldest daughter when I was 15. We talking about youth, we talking about those kind of things, and I'm blessed that I had support to get to the place I'm at. And so I feel like the nonprofits, the people that are on the ground doing the work, they're where we're gonna have to start. And as communities, we're gonna have to encourage people. So we're gonna have to be the ones like me going to my doctor colleagues. One of the things I do, I sit on the Montgomery Cares Advisory Board as a representative for the Montgomery County Medical Society. So part of what I'm gonna try to do is go back and say, I need you to do some pro bono work. As you go come out and see a patient for me, like what can I do to get those people involved? Can people who are already landlords go and talk to other people? Because my friend who's a landlord, I asked her, she said it's because they don't pay market rates for rent when it comes to HOC. So, and I know I'm talking fast now because I'm a little, when I get upset, you know. But I do care about the population because I recognize my blessings and where my life could have been, and that anybody in those situations could be our brother or my mama or my sister or my son. In a few years if we don't address those other issues. So I think mental health is where we got to start, and also really giving the support to the nonprofits and to for-profits who are willing to come out into the community and do that work.
Thank you. Okay, no, it's just a quick.
Please take your time.
When I get in trouble, I turn to Montgomery County because for 23 years I worked and paid tax in Montgomery County. My son that has bipolar was born in Montgomery County, so I couldn't go to Carroll County or Howard County. I turned to Montgomery County. Thank you.
That was short.
And I may be even shorter. I want to applaud to what you just said, because I think our faith-based organizations have failed in some respects of not being present and their voices not being heard. So our churches need to step up, and whatever we can do, we certainly want to stand in the gap and be that church, that faith-based organization in this community to be able to help those who are dealing with certain things like what you mentioned. Thank you.
You guys are so efficient. One more?
We need to start seeing the people experiencing homelessness for the symptoms of the problem. Like Dr. Kelly said, there is systemic failures that we need to address, and this community needs to start acknowledging that. We're very tired of hearing about how we need to get rid of them, get them off the streets, they're ruining the business. They are our neighbors, they are our community. We need to start seeing them that way.
Okay, no, I think that was a great way to end. But yeah, I think that it's the combination of all of these solutions. And with Montgomery County, we will do it with compassion. We will see our neighbors. We need to. And in the words of, I'm just going to invoke Dr. Casey Barker because she just did a series of trainings. She talked about stigma and how stigma kills. I think if we've learned anything today, that it's any one of us could fall into a situation and experience homelessness, and therefore we should not be a society that stigmatizes those when they're fallen. We have to help them get up, and we do that with compassion and with love. It's something that Interfaith Works has always embodied, and I'm so proud to be a part of it, and I'm proud to be in my role now, and we'll continue to do this work together.
Let's give the panelists a round of applause. Okay, so here's the wrap up. I was taking notes. Some of you may have thought I was texting, but I was actually taking notes. So I have a few solutions jotted down here that I think we can see how we can follow up on some of these. So one is around childcare. So seeing how we can fast track childcare scholarships for those who are experiencing homelessness. That's a great idea. That's a great idea. And I'm looking at Donna as I say this because she would probably say, and for people in vocational services too. But understanding that it's a very real reality that if you need, the way that the child care voucher system thinks it works is not actually the way it works. And I remember about a year and a half ago, we had a forum on childcare. And it was just amazing to see. We had folks from the state, folks from the county. These are people who are operating the programs. We had childcare providers. We had people who needed childcare. And it was just amazing to see how differently like there was a major gap between how it's supposed to operate and how it's actually operating. And you're absolutely right that the way that you've described it is actually how it operates. You got to have a job and have to produce pay stubs before you can get a child care scholarship so that you can get the job in the first place. All right, so that's a good one. Sanctions, well, no one said sanctions, but I'm going to say it. Sanctions for landlords who have chosen to find ways around the Housing and Justice Act. Like, that's ridiculous. So now the Housing and Justice Act prohibits you from discriminating by source of income. So you say, okay, well, I'm going to require 3 times the amount of the rent for your annual income. Or a credit score of 700. There has to be accountability for that, right? And we do have some tools in place in Montgomery County, and I would like to see some ways for us to begin to hold landlords accountable. Yes, we need to take both the carrot and the stick approach. I heard you loud and clear, Stacy. But while we need to find ways to recruit landlords who are willing to sort of give a second chance, right? We need to do that, but we also need to hold landlords accountable. And what I hear often from our teammates, from other providers, is that there seems to be a lack of clarity about how to make those reports and then providing the people who have been discriminated against with the resources they need so they can actually follow through, right? Like if you're looking for housing, I've heard this many times. I'm looking for housing. I know this landlord discriminated against me, but I don't have time to pursue that. I'm just trying to get my housing. And so by the time it comes to our attention, sometimes it's too late. Another solution, capitalizing on what the Biden, I heard you, Councilmember Sales, on what the Biden administration is doing to try to convert office space into affordable housing. That is a great idea, and I'd like to see how we in Montgomery County can try to scale something like that. Plug, in January, last Thursday of the month, we are having part 2 of this conversation, right, Rosalind? And the focus will be affordable housing. And that's when you'll get an opportunity to hear from some of the folks here, but also people like Pastor Warner and some of the other faith communities who are finding ways to use their church property, their houses of worship, to convert and find affordable housing. This is an untapped resource in Montgomery County. Prevention, that's another one that I heard. And really, well, I think we've already described it, right? Like, prevention should be readily available. And it should actually be able to prevent homelessness. I think there's a lot, and I really give the county credit for being able to step up during the pandemic, making good use of the federal funds that we were getting to be able to scale the prevention efforts. We do a lot at Progress Place, but I think Liz has counseled me that it's not actually prevention, it's more like rapid resolution, right? Where we help to get people, right, we help to get people quickly out of the shelter by giving them sums of money that will enable them to obtain housing. But that's still a resource that works. It still works. Mental health support. We heard that, I think, from many of the panelists, loud and clear, that additional mental health support is really, really important. And then we need to be able to figure out, clearly address, call out the systemic failures that continually tip people into homelessness, long extended periods of homelessness. Okay. Yes, Councilmember Sales.
I will just say that I believe we are in our 2nd year of the Universal Basic Income Pilot Program, and that we are seeing very good results. And hopefully, if we continue to see good results, that's something that will hopefully pick up on the national level, or at least across the state. So continue to champion those efforts as well.
Do you want to take 30 seconds to tell people what UBI is?
Oh, UBI, Universal Basic Income. It's an interesting dynamic to provide. We're doing a pilot program. It started before I was on the council. We're now in our second year. They identify residents, whether it's a family, individuals, and they get a stipend every month, and they are not guided on how to use it, how to save, but they are able to do whatever they need to do. Some people are saving, some people are able to, buy a new car, or send their kids to a dance program, or any number of things, but it just gives you a bit more breathing room to ensure that you are just making just the bare minimum what you need to be self-sufficient in this county. And so, but that could also impact the other social services that you do receive. So we're not trying to eliminate the role of social workers, but we are trying to give people more ownership of how they are able to manage their money. And we also have to ensure that they have the capacity and the mentoring from financial planners. So we also need our banks and our financial planners. Tax season's coming up, and so if you don't know about the Volunteer Income Tax Preparation Program, please take advantage of it. It's free tax preparation, and usually at the events they have access to banks where you can learn about better ways to manage your resources. So looking forward to that.
That's another one that we should talk about, earned income tax credit. Earned income tax credit is a huge resource for people who are working, and across the nation, maybe I'm being hyperbolic, but I think it's like billions of dollars of unclaimed EITC. So if any of you know people who are working, not making a whole lot of money, and could really use a little bit of money at the end of the tax year, earned income tax credit. We will be, that's another solution. We'll be having some folks from VITA come to some of our shelters and sit and at least give information about the earned income tax credit. Okay, it is, 9 o'clock on the dot. All right. Thank you, everybody, for coming. We'll see you again in January. If we don't have your email address because perhaps you missed the opportunity to sign up, please do see Roslyn or Tracy before you leave. Thank you very much for your help and attention.